Hi there, everybody. Good evening. Yeah, I went and voted today, but they sent me to different precinct, and then I had to travel two precincts before I could vote. But went very well, very simply, and I was happy that I was able to do because all the time I was doing mail ballot, and somehow this time I did not receive the mail ballot. So I was determined to go. I was very busy actually, but since till I went and did my duty, so that was good. By the way, I was applying this integrated yoga into a book I wrote this afternoon. That was about something I talked earlier uh, about how we can uh, really practice some practical steps uh, every day. Like 10 things that I've talked about. They're really part of the integrated yoga, but this is kind of presented in a different way. You know, I hope to catch that, but I'll just take a minute to list them. I'm not going to discuss like I discussed this morning, and our friends were there. They also contributed. Um, it is about cultivating awareness in the morning, and number two is nurturing self-compassion and acceptance. Number three is practicing gratitude as a daily ritual. And number four is encouraging letting go of our attachments and our expectations. And number five is foster connections with others through empathy and service. Right? And number six is encouraging self reflection and inner inquiry. And the seventh one was incorporate a practice of meditation and mindfulness. And number eight is embodying the love as the foundation of life. And number nine is align with a higher purpose and selfless service. And number 10 is celebrating life with playfulness and a light heart. So those are actually form several aspects of the integrated yoga too. What is integrated yoga? People know yoga means get a mat, spread it on the floor, and do a few asanas and breathe and maybe meditate a little bit, and that's it. But they don't know how to take it to, like I take it to the job, and I take it to the activities that I do. I take it to my hobbies. I take it to my mind exploration or devotion or my spirituality, and also whatever life you have, action, devotion, focus, knowledge, all those are like a yogas for the life, for our life. Every aspect of our life can be touched, but doesn't mean you go crazy on yoga and no. It is like how you maintain your mind in balance, how you maintain your mental health, physical health, spiritual health in balance. Okay, so if you take it just like that, it becomes very practical and also very easy to maintain the health and face problems in life equanimously and enhance your quality of whatever you are doing, you are playing, you are entertaining, or you are entertained, whatever activity is there, that can be seen through the lens of the yoga, which brings you real balance, serenity in the mind, kind of not being too much attached to the events in life. So all in all, they become very powerful. These yogis who practice this, look at a general, sincere yoga person that was in the earlier times, where it was all forests and hills and very few lives. They avoided the urban or rural life. but they prefer living in the nature, right? That is something we have to do now to revive our earth, okay? And they had uh, fruits mainly the diet, and not that much of processed food, right? And they had to walk, they had to climb the hills, they had to go to very difficult terrain, desert to, all the way snow, and very thick rainfall, and very hard summers, hot summers, very hot summers. So they had to deal with the elements, but then they knew how to really overcome the elements. That's one thing too. And then they were so resilient inside. They lived not only average of 120 years, but also they lived very well. Late, very late they, I know modern yogi BK Iyengar, who has 10 to 13 million followers in America. He did yoga up until 2 days before his death. Okay, and so they live very quality life, very very, and then they can let go their life that easily too. They can die on will. That's that too. But it's a different matter. But look at all those things: living away from the civilization, living away, but then helping the civilization in a major way, right? And then they have few things, but they lived in joy inside, generated by calming their mind and going into the depths of their being, right? And that was one way they kind of understood the subjective science of ourselves. Modern medicine, modern science looks objectively out there and then fixes everything, finds out things and all that. But if you take the inner health, there is definitely the winner is ancients, because they had calm mind, they had a lot of love for everybody, and they have uh, real good mental health, because they don't have this afflictions of modern life, right? So many things that they don't have that, and they related to everybody like they are their own. So all in all, psychological health was much much better, neurologically stable, and they kind of lived long life, and that was a joyful, very productive life, right? Whatever they did, a pure yogi will do with a quality that marvels the highest talent people, So uh, you basically neurologically not going that way, this way. You are stable even when the situations are really bad, right? So that's what happens with the lifestyle. So it's for me, it's kind of lifestyle, but with a deeper understanding our inner mechanisms, how we think, how we feel, how we develop qualities that will not drag us down. So basically, we are like a martial artist inside, and then coming to life gently and dealing with it with strength, with the vigor, with a lot of vitality, So they didn't carry any weapon. They kind of were non-violent and did not really uh, uh, have any tools to fight people. But the moment they went, the other people had so much respect for these people. Maybe their mind was so calm, they also calmed down, and they don't have any enmity, right? All in all, what I found was these people are very evolved inside. I'm not talking about any particular religion, Hinduism or that. No, they are derivatives after all these inner sciences happened in ancient India and other places too. So many people used to come to India, like they were coming to Harvard or Oxford. Now they used to go to Nalanda University in India, Takshashilas. There's so many universities out there. There's historical evidence that Chinese, Japanese, many other countries used to come and learn in India Sanskrit, mathematics, and astronomy, and astrology, and outer sky astronomy, and also really understood the health of the human body and human mind way better because they were relying on getting the healing effect within us to work better, and they got medication that are pretty natural, so there were no additives, no chemicals added there, but also they try to avoid to give medication first because they were trying to treat your mind, treat your inner self, and all that, and also the physical activity was so much prevalent, and they were kind of moving a lot, and also they had this habitual thing about calming the mind. They didn't let the mind go where it is, they used only when needed, and then they slept very well too. So I'm giving a broad picture, but if you look at it, there's a lot of things that we could revisit, and we could change our uh, things a little bit, the lifestyles and habits, and we are the beneficiary of that wisdom. Okay. Uh, Actually, even though I was born in India, I was not shown the depths of yoga in my lifestyle. Ours is a completely urban lifestyle where we have all the modern facilities and all that. So once in a week, our physical instructor, a PT instructor, he used to make us do some yoga asanas. That's all. But nobody told me that this is so such a depth and such a understanding of the human life, understanding the human being's inner life, like the psychological, philosophical, religious, all those things, they understood much better, right? For example, they said you have kind of 5 layers, really one top on another, kind of covering your real inner essence. The first layer, they said, it's like a physical body, or bones or muscles or organs and all. And the second layer, they said, your energy layer, tied with breathing quite a bit. And the third layer is your thoughts, your feelings, your moods, and all that. Okay, and they're very subtle, but in there. And the fourth layer is your take on the world, your understanding of affairs, and how do you have a perspective on these things. That is the fourth layer. And the fifth layer is the genes or the karma share that is responsible for us to come out. And at that level, we are blissful. You don't have any mental hesitations or physical problems and all that. Okay. So when I heard that, I think maybe around 40 years I was when I heard that. I didn't know that before, because the moment I took up on yoga, that was in 1985. I came to this country in exactly today, November 5th, 1981. I came here. Okay, a friend is coming. Let's see. Hello.
I can't get this off.
Hello. Okay. Maybe accidentally. That's okay. So I was 81 number I came, right? And then it is more like a 85. I think I was I picked up a book by B.K.S. Iyengar. It's a role, it's a very spiral book, but it's on about light on yoga, so he was talking about them very simply, and I was very interested in that. So he gave a schedule of each week how you can progress slowly, but he was very descriptive. For example, there is a standing posture, Tadasana, right? And in that, actually, Samasthiti is called. Um, so what you do is you stand up and with your both your feet together, but your toes, your sole, your heel clutching the ground, and then you pick up the kneecaps, you suck in the abdomen, pick up the buttocks also, and then keep the hands straight next to you. And it's a kind of, it is described so well that you stand and then you start any asana after standing like that, So he gave a couple of, one is called like a plow pose, like a, the old fashioned plow they used to, cultivate the land, that kind of thing. And then also Sarvangasana, that is like a all so anga means body parts. All body parts get into that. It's more like a not exactly headstand, but more like a stand on both the shoulders and the head and neck, right? So it's a very very good. It works very well for if you do it daily. So he introduces a couple of asanas, and then once you get hold of it, then you will go to other things and then do those things too. But he gives importance to the breathing, to the meditation, and all that too. That is how it started it. But then I was very um, fortunate, I think. I got into um, talking to people who are way into that physical asanas, but they don't have any foggiest idea about the mental aspect of it and all. Then there was a serious works were there in yoga. I began to take it as a scientist. How is this working? How is that these people are living a long time? How is that they are having so much energy? How is that there's so little mental health problems in those cultures who practices this continuously? The moment I understood that, then I incorporated that into my medical practice to help my patients. One of the first things I used was based on what's called mantra yoga. Mantra means you take a word, or you take a sentence, and then repeat that continuously. So occupied you are, so your mind will not come back and interfere, and you have a mind that is quieted down, right? So it's very common. Very a lot of people used to do it, but I never gave value to that because I need to know how it works, right? But then I read a book by a cardiologist, Harvard cardiologist Herbert Benson, his name was. He wrote a book called Relaxation Response based on mantra yoga. Okay, and actually, what we did was for people who are anxious, for people who have very high blood pressure, we kind of gave them this relaxation response inducing exercise. So what the exercise was, you kind of take the same place every day at the same time. You come to the room and avoid all the distractions around you, and then sit down and close your eyes and repeat this. Whatever word you take, you could take one, one, one if you want to, and repeat that continuously for 15, 30 minutes like that. When you can maintain that kind of concentration, that kind of really focus on one thing, there is what is called relaxation response happened within your mind, right? So that is a very powerful relaxation for the entire body. So people who had been doing this, we got their blood pressure going down, and we were able to cut down the medications. And we got headaches going down. We had less risk of heart attacks and all that. So people began to like that, and some people are stressed out, use it too. So I introduced this book to thousands of my patients because whenever they have blood pressure and they come to me, I do treat them with the medications and traditional and all that, but then I introduce these kind of calming yourself down, using mind to focus on one thing, and thereby inculcating this relaxation response. I could recommend you guys check it. It's a very small book. He wrote, Herbert Benson, in I think Howard University. So yeah, he later on evolved that into a big institution called Relaxation Response Institute. That's very good that they were able to get that yoga into Americans' daily life, whereby they're getting benefit directly on their blood pressure. See, the thing with the blood pressure is if you leave it unattended and then you are exposing yourself to situations where your blood pressure suddenly shoots up, right? That's what we don't want. We don't want sudden elevation of the blood pressure. That is the rate of rise of it. If you raise like the systolic blood pressure, you stand to suffer a stroke because of the sudden elevation of the blood pressure. That's not there with that, right? Anyway, I have very good experience with that, prescribing to people who have anxiety, who have overwhelm, who have high blood pressures and all that, as as an adjunct to the medical treatment, And then we were able to reduce the medications quite well, That was a good thing. Of course, diet and moving, all those exercises were given, they did them. But the main thing was every day at the same time, go to the same place, a private corner in your house, sit down and close your eyes and take anything that you like, one word, one sentence, or one mantra, whatever, right? And then repeat the same thing again and again and again, so that your mind won't go anywhere else except coming back to the word you are saying. Okay, that's a one pointedness. That is the one thought you want to do. Okay, so that was described very well after. And then I came across certain very highly regarded sages, but I never met them personally, but I was able to read and look at their talks and all that. One was J. Krishnamurti, other one was Ramana Maharshi, right? And they're superlative beyond what we read in the medical school or wherever it is, right? And I think I was privileged to be exposed to such kind of extraordinary people, right? And then Krishnamurti got me into this world citizen mode and really understand how the brain and perception works and how our thoughts are limited and go beyond it. Ramana Maharshi brought me to that our inner abundance, asking the question, who am I? And how to inquire and all that. So anyway, so integrated yoga is nothing but whatever we live, can we do it in a yogic way? Suppose I'm a student, I'm studying, then I can work on the inner weaknesses of not able to focus or not able to question and learn from it, all those brain intricacies that you need to overcome your fear and anxiety, to be able to improve your intellectual capacity, to be able to improve your memory, to really let your imagination go and be creative. All these things are positive if you understand the mental yoga, mental part of it. For that, the famous book is Patanjali's Yoga Sutras. Sutra means it is made up of two lines, but the meaning is so deep. You can take one particular stanza. I can talk to you for 3 months. It's that deep, But the essential thing what they say is, don't let your mind go on chattering. Learn to stop it down. And then once you calm your mind completely and there are no real thought made things that are going on continuously, and your mind is quite that way, then your inner essence comes out. Up to them, it is covered by this chattering mind. But once chattering is not there, you will come back into essence and comes out. That is the most empowering thing I ever discovered, right? From then, outward things may happen because I had so many challenges, right? In our profession, in our family, so many challenges come, but it gave me that balanced mind to be there, not shaken, but finding out what is that I can do that can resolve this problem. So there's like a real strength, no anxiety, nothing, but the mind will be calm and quiet, but it works better. For example, um, we went to the to vote today, right? When I went there, I had to take a driver's license, so I took it and went there. Suppose a situation comes where you are driving to the airport and you have to leave the country, you're going some other country, and you forgot your passport at home. Normally, people go really let their mind create so much of anxiety, and then they don't even know that whole reaction is coming, and they can lose their peace of mind. They can be angry. They can be shouting. So many things can happen, right? That won't be there when you learn how to focus your mind and really don't know nothing. Okay, so that kind of thing. Okay, so practicality, living better happens when you are not reacting to every situation that comes your way. You're more like take it coolly and then do. That ability was not there for me before the yoga, but once I understood the mind reactions, mind compositions, now I know how to watch my thoughts but not be the thoughts, but I know how to use the thoughts when I need to see a patient or write a prescription and all that, but also I know how to empty my mind. So this is a contribution that yoga makes. Not only keeps you physically healthy, but also mentally stable. You're not reacting at all in the sense. We know from the modern science, when we react, we produce a lot of chemicals. That chemical reaction is worse than what has happened. See, so once you understand this Patanjali Yoga Sutras, you have this ability to keep your mind in one place, right? That's a big topic. I will talk about this some other time. But for now, generally, I'm going everything about very, very general. Uh, as far as patients and me are concerned, how I bring yoga into their life is, suppose somebody has a surgery, like a knee surgery, shoulder surgery. It's a very common. The patient comes to me first because I have to medically clear him before I send him to the surgery, right? Everybody knows about that. That's why I see them. But because I'm their doctor, I know mostly about their medical history, and they also trust me to get a good surgeon and also post operative care and all that. They feel confident if I'm involved. They usually call me from the emergency room if they go to the hospital for and possible. They want me to come and see them in the emergency room lots of times. We used to go and see them. And then once the surgery is done, again they will come back to me because they want me to be participating in their recovery, in their rehab, right? Um, the physical therapy and all that, they have really evolved a lot, but I would have to say they're way low compared to yoga type of rehab therapy. Okay, where you have stretches, you'll have understanding how to really overcome the pain and how to keep your mind quiet so that your healing abilities within you are enhanced. Or there's a routine where they show you how to improve your lymphatic flow, doing the routine from head to toe, and then your immunity definitely gets better than that. Okay, there are so many other reasons too, but that is there. So all the people who have surgeries, it could be abdominal surgery, but in yoga you don't give too many complicated exercises right away. You start what they can do. Like a small kid, take a small step, and then he'll collapse, and then you get up like that. You got to go that slow. But then once you pick up what it is, and your body really takes all that you are giving and then some, then it really not only cooperates, it's much better because it's much better that way. You know, that's one thing. Medical illnesses, I call them diseases of civilization. What does it mean? Diabetes, high cholesterol, heart disease from high cholesterol, COPD, chronic obstructive pulmonary disease. That's because of the smoking, and alcoholism, lot of liver failures, problems of cirrhosis because of the alcohol. Of course, medical, drug use, addiction. A lot of people get addicted to prescription drugs and also the recreational drugs and all. Addiction as a whole, I was able to help a lot of people come out of the addiction with the natural processes. Let's see who is coming here. Okay. Okay. So incorporating as an aid turned out to be that yoga is much better than the modern medication. So I jumped on the wagon and I was able to do well without medication, even now. Okay. I always tell people I'm almost 70 now. January 18th, I'll be 70. But I don't use any medications now. And I'm participating in life fully. I'm not limited by anything. And I exercise. I come and talk to you guys. And I go to see my people online, the patients online, and I do master classes, webinars, and also interviews. And my life is more busy now than before, right? But that was all made easier because I have this integrated yoga. Okay, one integration I think everybody wants to know is it's called Manasa Vacha Karmana. Manasa means what I think, what is in my mind. Vacha means speech, what I am speaking. And Karmana means what I am doing. So in thought, in speech, in action, I'm synchronized. So what I think, I will speak. What I'm speaking, I'm doing. So that kind of integration happens because you are more perspective. Because you take the body, for example, you don't identify with the body. You kind of use body as a temple for the divinity within you. That kind of thing gives you more responsibility to keep that body healthy, neat, and pure, right? So you don't want to put in all sorts of drugs into it, like alcohol, recreational drugs, and all that. And you don't want to abuse it by denying rest and sleep. You don't want to make it starve, but eat proper food, proper way. And you take care of your mind so that you won't be mentally ill health, right? So very much involved in regular life. So you know the body, how it is behaving, what is this intelligence, how you can listen to it, and then really invoke that healing effect all our bodies have. See, you have a cut, right? You may put some dressing or you don't have any medication, but then it heals by itself. That healing effect, that healing capacity is the intelligence of the body. Be in touch with that intelligence, be familiar with that, and that shows you what else you can do to heal faster and to get stronger and to really not suffer the physical illness and all of that. So that's important. That's why they were living on an average of 125 when this lifestyle was in vogue. Modern India was occupied by so many people, and then they tried to suppress that culture, and then it has survived with few. And then after everybody is gone, even though they are independent India, they are really living the Western lifestyle, which I think we can make a lot of changes. We can eat better, don't eat all the processed food, and we don't have to eat all the time. snacking all the time, we can change that, right? And then that's definitely Western thing. It was not there in the poor countries. First of all, they don't have the food. Second of all, they don't have that kind of culture, right? And the food is not pleasure; it's more like a necessity for them. And then because people have to walk a lot, and nowadays they have all cars and all the things. So, but before they used to walk a lot, and that is a good exercise for them. And they were always calming their mind, and also they were having a very good tight sleep. And daytime they worked and nighttime they slept, and that way general health is preserved. People used to get up in the morning, early morning, and do the stuff, and also go to bed early. All those things have become out of fashion now, but actually we need them. We need the rest. We need the complete recovery while at rest, both the body and mind, right? So that's how it happens. So anybody has any questions, you can come up and ask me now anytime. Um, Basically, I took a general topic, but if you have any specific way you want to find out about what is integrated yoga mean, how can we not religious thing, but more like a lifestyle thing. How we can actually yoga is not a religious thing in the beginning. What it is it was a lifestyle of the people observing animals and figuring out their own bodies and mind. People developed all these things thousands of years ago, right? But then later on, people used it and made it. But not all Hindus do the yoga, or yoga is for every Hindu. It's not like that, It is how much you take it. Like for example, I went and tasted 1%, then I wanted 100%. No, to know that's my enthusiasm. But once I discovered it, how it can help my patients became a big deal. And also now I'm looking for everybody and trying to teach them how you can be proactively well better by understanding these lifestyles. Okay, be natural, live close to the nature, eat naturally, and sleep naturally, and keep your mind also naturally. All these things were discussed. But then the intricacies, the depth of that is even modern psychiatrists, they cannot understand all that they are saying, because there's such a deep, very important work. For generation of humans, it is useful. Okay? So integrating yoga into your lifestyles has immediate benefits to long-term benefits. And then it takes a lifetime to even know everything. Okay, so it's a smart thing to do and understand what I'm talking about, the lifestyles, and change those small stages and then make them permanent and see how it is. For example, I'm a vegetarian, right? That's very healthy, actually, if you eat only vegetarian food, and you live longer. And also, your energy by eating vegetables and fruits is much higher if you do the all the principles. What they said, okay, don't pluck the fruits and vegetables, let them fall down. That's one thing. Or if you have taken from the plant, eat within 2 or 3 hours, because you want to keep the vital energy in the fruit or the vegetable from the plant, right? So there are a lot of observations like that that are very commonsensical if you look at it, but then people have not adopted them because it was not explained to them properly, right? And that's why people get shy away from that. And if you are doing yoga from the childhood, you will maintain the flexibility, you will maintain the strength, and all that much better. But if you allow this modern creature comforts to get to you, and then 10, 20, 30 years, you become flabby, you become really low in energy, and you don't have the body intelligence anymore, then it becomes very tough to shed the pounds and then really get rid of those bad habits, right? But yoga helps you not to cling to anything. Okay, so I'm going to talk more about this integrated yoga as the time goes by. But basically, according to the patient, I go. For example, somebody comes to me saying that I'm getting very paranoid, very scared. I cannot go out of my house. That was an actual case. And she was very afraid, agoraphobia, they call it. That means they cannot get out of the house and they have to stay in the house all the time. And they cannot even go to a supermarket on their own by themselves, too. So it's a very tough life for them. So I taught her how to be aware of her fear. She was, before she was indulging in the fear, it is overwhelming her. But when I told her, just stay put and don't say anything about it, don't judge it, don't say bad or good, but just be aware. When the fear comes, we will be aware. And she was told to be aware at the time of the fear. So she goes out to the supermarket and then she gets this overwhelming fear. And then she was aware and it went down because she was not allowing to go further with the thought matrix. By being aware here and now with what is happening, you are not forming the thought matrix which gives continuity to the fear. So that is not there. The moment it hits, you don't have to take any medication, you just be aware. But then you can start practicing being aware from morning, then it becomes much easier when some fear like this protrudes or projects in yourself, then you can be aware and the intensity of the pain goes down. Okay, so we did with her and she was fine after that. Okay, so any number of areas, psychological problems, suicidal ideation, drug addiction, or depression, anxiety, unless they are like a genetic based organic problems and all that, it's very easy to cure the thought made, emotion made disorders that people are allowing them without thinking about it unconsciously, and then they play the victim, right? So but if you want to be in charge of your physical mental health and you want to really have ways where you don't have to use medications, I think you should try them. And then yoga is one of them. Pilates or martial arts or playing gym, going to the workouts and going to the treadmills and walking, all those things are okay. Any form of exercise is good. But the yoga, what it does is it can make you much more alert and aware of your conditions and also inculcate the healing effect within our body so that we can fight the infections better, we can get better from the illnesses and all that. Okay. So I just felt like I wanted to go on this way and telling people about why I kind of adapted and what were the benefits for me and all. So I saved a lot of probably my petrol and my money, my time, because I don't have to go to the doctors because I'm basically healthy. But you can go and check it out yourself, and that is something I do. But I keep an eye on what is going on, so I know when to check, when not to check. But a lot of patients may not be able to catch them when they're early, the illnesses, and then when they come, it is already too late. Okay, so what I'm saying is, look at these ancient wisdoms with an eye on how can I have some insight about whatever I'm doing and really learn and implement it in your life. Okay, and if you have some addiction problems, then yoga is very good, but it has to be very meticulously done, and then it takes some effort on the part of the patient too. Um, of course, it can change. If you are obesity, it will give you a relief. If you are having too much weight loss, it can help you. You are a very old man and you are very frail, you're not able to walk, you're not able to do the stuff that you used to do, and you lose your independence. And those people I have, small micro yogas and then custom. That's one thing with yoga is you can customize to very young kids, even infants, to all the way very, very old people, very frail people, right? And then in between all age groups, all genders, and all nationals. All anybody comes, he's a human being. For us, it's the same thing, some cultures breed more mental illness, like America is doing that now. So we have to introduce this to, and there are so many studies, meditations, and all those done too. There's a lot of evidence if you want that way. But for me, thousands of years of wisdom cannot be put in a bottle. You got to really pray, respect it, and then learn from it, and then use it in our life. But they can do experiment. They can show what is safe, what is not. But in yoga, what it does is you got to do what's called sthira sukham asana. That means stable, comfortable position. Whatever asana you do, you have to have that as a guidance. It should be stable and it should be comfortable. No pain in yoga. And the other places they say you have to have pain, you have to do all that. But no, in yoga, it's a gradual improvement that's important. You don't have to do push yourself. And even if you have pain, you don't have to worry about it, because you can stop and then get better and then do it again. That's what the yoga taught me about not using pain medications, not really neglecting the body, get enough, take care of all the lifestyles, and that what is there. Another thing is, it helps you to overcome suffering, and also it helps you to gain bliss within yourself. So I think we've almost talked about 48 minutes. So anybody wants to come up? The last chance before I close the room. Don't be shy. This is a topic that I want to enlighten you about. What is the proper use? Where do you stand? How fast we can go? How seriously we should take it? And how does it help us to cut down a lot of things? Like you have stiffness, you have aches, you have sleepiness, you have problem of insomnia, and you have weight, obesity. I wrote a book on the obesity too. It's very different from the modern treatments, because I used to get these patients for obesity, and they are my patients. I'm following them, but they decide to go for a lap surgery or bariatric surgery. I had to send them to this institute which who does the bariatric surgeries, and they are only 45 miles away from me. So I used to clear these people and then send them, and also they wanted us to train them for 6 months of what they are going to do, and basically allow them to be on diet, exercise, and all that, and monitor that, because these are all patients, they are close to us. And each month they have to come and check their blood pressure, blood sugars, all of that, compliance to the diet and exercise. If they cannot do it before surgery, they will not be able to after surgery. That's why they make them do that. And I used to clear people like that. So then I used to tell them these alternate things. I said, okay, Melissa is coming up. Okay.
Hi, Dr. Rao.
Hi, Melissa. How are you?
I am doing very well, thank you. Yeah.
Your audio is gone, Melissa.
One point, a doctor suggested that I have that done.
What was it done? I lost you. You're losing the audio in between.
Oh, I'm sorry.
Yeah.
Can you?
Yeah.
Around?
Now I can hear you. Yeah.
Okay. No, I was just saying that when you were talking about the bariatric surgery, I was intrigued because I remember at one point a doctor suggested that I have bariatric surgery, and I was very adverse to that idea. I was like, oh, no.
Yeah.
And I just kind of wonder, like, as far as like doing it, like, losing weight, like
Yeah.
by, mind shift and exercise and
Yeah.
counting calories and that sort of thing. Do you find that that's a much healthier and safer way as opposed
Yeah.
to the bariatric surgery?
Yeah, yeah. Because lots of times you can have genes for the obesity from the family, and but majority of times people eat a lot. They don't have a discipline and they don't work out, and but that's not everybody. Some people, what is called, there are three types of body types: ectomorphic, endomorphic, mesomorphic. Right? In ectomorphic, they are tall and thin, and they can eat a lot, but they don't put on any weight. That means their metabolism is pretty robust, and then they burn it off. Uh, like the other extremities where they don't have to eat anything. They see the food, they put on the weight. You know, that's a type of the body. Apart from that, many people, because of the eating habits and the modern era, they kind of lose that control and they eat a lot and they don't move much. That's why they put on that. Those kind of people reverse their behavior. They can really go proper sensible eating and also move the body quite a bit. Then they will slowly use it. But then martial arts, yoga, pilates, what they do is they actually accelerate your metabolism from within. You have to have a right training for that, but once you have that, you have to do that properly. Then you will not have to go to the surgery, not take the medications also. Actually, I wrote the book on the obesity for my cousin who is only 12 or 16 years and he's massively obese. So their parents were very worried. So for them, I wrote this book with the perspective of what did the ancients do to encounter the obesity. First of all, people don't have this body image because they taught you that you are not your body or how the body appears, but you are that inner self. That is what you are. So you don't have a complex, oh, I'm a fat guy, I'm a fat girl, or whatever. You don't have to have that kind of body image problems, right? The other thing is, many people have problems with this taste. They can't get over the taste and they have to eat a lot and all that. There is a process called pratyahara where you withdraw the senses and get control over the senses. Okay, like that. There are breathing things that if you do only right nostril, Melissa, you lose weight. Do you know that?
If I do, say that again. If I do what?
Right nostril breathing. Only through the right nostril, you can do that several times a day, and then you lose weight.
So you're saying if I just plug up my left nostril?
No, not plug up. Just to block it a little bit and then do that for a while and release it and then normally breathe like that. There's a special training for that. Once you learn that, then you will be able to do the right nostril breathing and also burn calories.
Oh, well, I want to learn that because I've been doing a lot of hard work, Dr. Rao.
Yeah. No, I think you should consult me. Then I'll guide you with that. All those things.
Okay.
Yeah.
I will definitely consult with you about
No,
that. I would love
seriously, book a time and then I will talk to you. And then I do that with a lot of people now because first thing is I've seen a lot of girls and girls really suffer the body image problems, bulimia, all that, right? And that is terrible. That's why I attend to them. And also, other thing is, a lot of these people want to get married and they want to lose weight very quickly, and that's understandable. But then I usually tell them these are small changes, but permanent changes, Melissa.
Yeah, that's what I want.
Yeah.
I want to do permanently change.
Yeah,
absolutely, Dr. Rao. I've been, I've lost about almost 45 pounds. It kind of fluctuates, but I've been, working really hard at it. But I definitely would love to consult with you if you think that right nostril breathing would be helpful.
I can tell you, you will thank me.
Well, I thank you already because you're just an amazing man, and I just am astounded by the wisdom that your brain contains. And I would love if there was some way I could just like absorb your knowledge
Yeah.
because you just
The
never
simple
seem to
things.
fascinate me. I was
Yeah.
listening to you earlier today
Yeah.
when you were talking with Elizabeth, and you just fascinate me the way that, like I said, you have all that knowledge in your brain, and I'm so thankful that you share it with us because that's what a true master and teacher does, and you are that, Dr. Rao. So thank you.
The simple thing one you do right now is, Melissa, how many times you eat in a day?
It depends. I typically have 3 meals, but like today I didn't because I wasn't hungry. I just had 2. So
do this. Only one thing I'm going to tell you. Do this. Don't eat unless you are very, very hungry.
Okay.
Make yourself starving from. Suppose you are eating at 11 o'clock. And that is the time you are maintaining, but you are not hungry, but you still have to go on time. Thinking that this is good for me, I eat on time. Don't do that. Let the appetite build up. Actually, the description is you're starving, and take that a little bit of in the beginning is going to be tough, but a little bit of it, and then eat, but also eat slowly. Okay. And also don't drink water before, and don't drink water right after you eat. Maybe a little bit to get it down, but too saturation of the food is not good. Okay. The juices in the gastric juice and all those things. So all you have to do only one thing: eat whatever time it is. Suppose you are eating lunch at 12, you're not hungry. Wait till 1 o'clock, 2 o'clock, even 3 o'clock, and then eat it. That is the principle for every meal. And no snacks in between.
See, that's where I get in trouble with the snacks.
But you know what? What you do is you change the snacks. Go for the low calorie. Go for some healthy snacks. I have a list of them I can tell you. Like, for example, dates. You know the dates? Yeah. Take 1 or 2 of them, slowly chew them. That will be very helpful for you to stay away from eating a lot. Another tip is, from the time you become hungry till the time you get a feeling of satisfaction, we call it satiety, right? Everybody has that, but usually whether you eat or not, it is only at the 20 minutes you will become satiety. Okay, so that's why what you do is take time to eat your meal. Don't sit down and eat very rapidly or talk to somebody. Be very aware and savor the food, but chew slowly. And then eat.
So that's where they told you, like, before they should chew your food like at least 50 times.
Yeah. If not 50 times, just enjoy. Take lots of times my colleagues, they come where I'm eating leisurely in the middle of the busy day, and in our dining room, the doctors have the special dining rooms, right? Sometimes, and these guys come, they grab a sandwich, and then before they leave the door, they eat it already.
Oh wow! Yeah.
They're kind of stuffing it, that's not good.
Yeah, they're like, that's what I was thinking. They're like inhaling their food. Right?
Yeah. And then they really, because they are such a hurry, they want to go and all. It's not really needed that much. Unless you are an emergency, then you should not come for the food if you are an emergency. If it's not there, it's their inner compulsion of hurry that is making them do that. Right?
Right.
Yeah. So eat only when you are hungry. Even when you are eating, sit down at the table and chew slowly, savor your food, and then eat.
Well, thank you. I'm going to try those things out tomorrow because I have just made my lunch for tomorrow. I have that in the fridge. And so I'm going to try those strategies out tomorrow. I'm not going to eat until I get really hungry. And then I'm going to try to remember what you said and chew very slowly, and that'll help with my satiety. And when you have a chance, I'll send you a back message, and maybe we could do the consultation like you said.
Yeah, do that. I'll show you that book also. Probably you can use that also. Okay.
Oh, Thank you again, Dr. Rao. Like I said, you just amaze me with the. I know it's not infinite, but it seems to me like your brain just contains this infinite amount of knowledge, and I just love hearing you
No,
share it with
that
us.
is
So
our.
thank you so much.
We are fortunate that that wisdom was there, and only I'm trying to cater to my advantage of my patients and the people who consult me, so that they can improve their lifestyle better.
Okay, I'm going to ask you a really deep question here. Do you think that you have like somehow tapped into like the collective unconscious? Is that where you get all this knowledge?
Definitely, definitely. We all can do that. We all can do that. We are, because we are so occupied with the superficial mind, we don't open ourselves as a channel to the infinite. You can do that.
Well, I'm gonna be your student, Dr. Rao, and I'm going to wait patiently until you have the time to teach that to me, because that would be amazing.
No. You just send me questions. You meet me. I will. You can bring the topics here. We can talk about it for the use of everybody. Or you want personally talk to me. Some people do that because they don't want to discuss their problems on the, which is natural, right? All the patients, we give them privacy, and then we allow them to learn. But the thing is, when a patient comes to me, initially they feel like I'm giving them a lot of homework, but then they love to take it later on because they see how good they feel, how much energetic they are, and how light they feel.
Being a teacher, I'm used to having homework all the time, Dr. Rao. My computer is sitting right here in front of me because I have homework to do. So I'm going to thank you again and say goodbye so I can get this homework done and be ready for tomorrow. But I will let you know how that works out for me tomorrow. And thank you again, Dr. Rao. You have a wonderful evening, sir.
Contact me offline and we will talk, okay? Okay, Mabel. Hey, Mabel.
Hi. Hi, how are you?
I am good. How are you?
I'm well. I'm very well.
Yeah.
Yes, I'm just listening to you. Whoa, that's beautiful.
Yeah.
You know what? I remember when I get pregnant, and then I worked, right?
Yeah.
So I gained weight. I gained weight. The thing is, the, mine is a little bit have a complicated because I have a lot of water retention.
Some people do that, yeah.
Yeah, so what happened is they said like I'm just lucky that my water is not go all the way up that some people they cannot breathe because of that water.
Yeah.
So my face is like swollen, and then my feet is just like I cannot imagine like, oh my god, what happened to my legs? My leg is super swollen, and because of that, and I have CS, so I have so it's for me to recover. It takes time, like it takes time because first I have to heal my wound.
Yeah.
Yes. Yeah. Even I cannot carry my baby because I have a cut. So I'm just if I carry my son, it will. I'm scared that my cut will be open and then it start bleeding.
Yeah.
So so for me, it's very, very, very slow recovering. Yeah. But I end up having postpartum.
I was wondering, Mabel, are you salt sensitive?
I don't know, doctor, because when I was pregnant during the pregnancy, I am healthy. Like every time I go to the doctor, and then my blood pressure, my everything is healthy. And then actually, my doctor told me like, oh, you can give you will deliver your baby normal.
Yeah.
Yeah, and it's positive. And then the time I'm working, and I am more on walking because I work in the pharmacy, so I work more, and then I have a lot of exercise in that time that when I was pregnant. But what happened is during my labor, so I stay in delivery room for 32 hours.
Yeah. Now I see that Have you heard me talking about antenatal, postnatal yoga?
No, no, I
No.
think I missed that one. Probably it's in your
Yeah.
record. Yeah.
Basically, what it is some
Mm-hmm.
women they start to retain the water after the pregnancy.
Yeah,
Okay.
I think that's what happened.
Yeah, yeah, they are normal before, but then this can be corrected if you know the whole water metabolism picture. You know,
Mm-hmm.
so like I told Melissa, you also make an offline contact. We'll sit down and I'll tell you some practical things, and then you can
Mm-hmm.
start doing that. But some exercise I have to show you, and then
Mm-hmm.
do you come to my morning routine?
Yeah, I do. I actually I do, and then
Okay.
I start doing your morning routine every time.
Okay.
And sometimes
No,
I'm late.
tomorrow,
Sometimes.
tomorrow I'm going to do some special things for you, addressing like a pregnant woman before pregnancy, after pregnancy, what they can do and how it helps them. For example, your thing, the water retention problem, then I will show you some exercise that you can do easily that will reduce slowly. It won't be miracle, but slowly. But then once you pick up the gist of that exercise, that will be much better for you. Next time you're pregnant, you won't have this problem.
Yes. Okay, so now, doctor, so now my son is already sick,
Hmm.
but my body is already recovered. But I'm just telling you that what happened to my body in that time is so like it's overwhelming for me. Like, oh
Yeah.
my god, what happened to my body? What happened to me? Like,
No, no, you were not trained properly for the pregnancy and what happens after that. See, antenatal yoga, what it does is it helps the birth canal to loosen up. So that, say, for
mm,
example, in our own case, our son, when he was born, right, my wife did that antenatal because sincerely, because she was home. I was working in the hospital right across is our apartment, right? So it's easy for her to stay and then take care of everything. Uh, but she did very religiously. Her primary labor took only 4 hours for her.
oh, that's
Yeah, that's how you got to. What happened? Your audio is gone. Are you there? Can't hear you. Mabel, are you there? Okay. Anyway, I hope you are hearing me, that I can continue this. So all it is understanding the dynamics of pregnancy. Yeah, I can't hear you. You're muted, Mabel. Yeah, I'm good. You're here. So it is kind of understanding that, and then employing uh, preparing your breath, your body metabolism, and also your birth canal. Normally, it is very painful, but that won't be that painful when you practice these things. Okay, so I will school you on that. No, don't worry. You'll understand better. And then all my patients, I give them some advice when they are pregnant, what to do with the breathing, what to do with the movement, what to do with the mind, and all that. See, many of them have this what's called preeclampsia. That's a very toxic thing, and that can show with the edema, high blood pressure. Did you have high blood pressure, Mayo? You got to open up your mic and tell me that. So those things, we can sense that sometimes first pregnancy may not do that much, but the next pregnancy can do that to the ladies too. Anyway, we'll talk about this privately, so that I can give you some pointers. That way you will use them. Yeah.
you know,
Um, and now I
hello.
can, yeah,
Oh my god! I think there's a connection. Like, if somebody live and then you are live, there's it's like what do you call it? And I don't know what happened, but anyhow,
yeah,
yeah, I I get hypertension during my
yeah.
during the
That's a,
dur-
yeah.
during the giving birth.
Yeah, that is pretty indicative of the eclampsia. That means it's a toxic thing actually. But yeah, but then there are ways to relax you, ways to help you to manage that, and also there are ways we monitor it. Sometimes it could be dangerous, but many times people end up with this kind of uh, the balloon, and then they cannot get it out. The water looks like
Yeah.
a spread. Yeah.
So what happened, doctor, when they released me? So I'm just, so I still have that kind of stuff, like I'm swollen and everything.
Yeah.
So I just start helping myself. Like I was recovering. First, I have to make sure that my wound is already, it's
Mm.
healed, and then I start slowly and slowly recovering myself. That
Yeah.
to help all the water retention go away in my body.
Yeah.
And then it takes time, like probably a month before it submerged, like my, I can feel like my legs is getting
Mm.
getting smaller, until it's been now I feel better. I bet, it's
Yeah.
I'm back to normal. But in that situation, if
Yeah.
you don't know what to do, it's just so scary. It's
Yeah.
just like, oh my god, what
Yeah,
happened to me?
that is a postnatal yoga when you
Uh,
tell them to get back the normal shape and also abdominal fat going and also reducing this edema. That's a pretty big problem for women. And also you have the chance of getting this again when you become pregnant again. That's why
uh,
you got to do this antenatal postnatal yoga from now slowly
mhm.
and build up to the peak before you get pregnant or after the pregnancy. That way
Yeah,
you don't have to go through these complications. Um,
yeah,
so we were treating this actually antenatal care is we always measure the blood pressure and we make sure there is no salt in your urine and there is no edema on your body. All these things.
yeah.
Yeah, blood pressure also is always measured. But even in this time, a lot of women are dying because of this preeclampsia. So we can
Yeah.
easily take care of that. It's a question of doing the right thing.
I think this topic is very important, especially
Yeah.
who is planning to have give pregnancy and stuff.
Yeah.
Actually, honestly, doctor, that's the reason why I cannot having. I said, like, I think I need only one child because it traumatized me until now. It's like, oh,
Yeah, yeah, yeah. I know it's a question of knowing these things, and then it is a common
yeah.
knowledge. Lot of yoga trained people train you in that. It's a very popular topic. One of my cardiology friends, his wife is also a cardiologist. So they are very dear to me, and then they got married right in front of us, and then they were expecting their first child. When I heard that, I sent her a antenatal yoga video. She thought that
Oh.
was very thoughtful and all that, but then she did that and she got the benefit of that. So
I see.
yeah,
Yeah, I think this is the perfect topic to, especially to who is planning to have to get
yeah,
pregnant, and then it, at least they have awareness for this. Because for me, honestly, I'm just like scared to death. Like, oh my god, what happened to me? But I'm very scared. I always pray to God, like, Lord, just help me here, guide me here. It's heal. It's actually it's healed naturally.
yeah.
It's because I believe that I will heal,
No,
and I
this
believe
is a major topic in the hospitals because we don't want women die of the eclampsia, right? So that's why
yeah,
the thing is to measure blood pressure, weight, and the urine and the edema. It's very common, but yoga shows you the ways not to accumulate the fluid. Yoga shows
mhm,
you how to relax, not to have your blood pressure go up like that. And
yeah,
yoga also shows you how to purify yourself with the diet and fluids.
That makes sense because
Yeah.
after I give birth, I go back. You know,
Yeah.
since I have a little bit knowledge of yoga, but since I have I go back to that. I go back to the basic one that I think it helped me. Like I do a very low intense exercise, and
Yeah.
then that is very very
No, no,
helpful.
yoga can be customized like that. You see, according to the person's capacity, like a frail old woman, 85-year-old came, then I designed that head to toe yoga, you know. So, like that, babies, you can put your son on yoga. I'll show you.
Yes,
I'll show you.
yes.
Yeah, I'll show you. And then you know what happens? You don't have to do too much because he's naturally flexible and all that. What you need to do is you have to preserve that body intelligence, I call it, you know, through
Mhm,
his age. Because we don't they take care of that, they lose that
mhm,
body intelligence, they become stiff, like old people.
mhm.
Yeah.
Yeah, it is. It is because, um, for me, like especially Nicola, he is hyper.
Yeah.
He's having
No, no,
hard
no.
time to
We're going
focus.
to teach you a game, yoga game that you play with him.
Really?
No, no, that's
Yeah,
you'll play with him, and that becomes yoga for him.
yes, he
Yeah,
loves it. Actually, you know
yeah,
what, Dr. Rao,
yeah,
every time I open this app, like this app, and then he actually know how to click the meditation and the exercise,
yeah.
and then he was like, Mom, exercise. I was
Yeah.
like, okay, pick which one you want, and then he will pick the meditation and the exercise. Like I was surprised, like oh my god, he is, and then he just loves to do the weights. Like I have a lightweight here that he can carry like oh this is heavy for you, but he will hold it and then he start doing things like
Yeah.
oh I think in the future he'd love to go to he wants to do that, like I
Yeah.
can see him. I
No,
can
no,
see him.
it's important for us because especially if you have ADHD tendencies, this calming down methods that we use, they help a lot for them. Yeah.
Yes, it's very helpful. It's
Yeah.
very helpful. Like every day before I send him to school, so
Mm.
what we'll do, I will go to the park, and in the park there's a lot of exercise thing,
Yeah.
and then he will climb, and then we will walk in the around the park, and at least he already have some,
Mm.
he already start, a small exercise, and then he's ready to go to school.
Yeah. Now we'll
Yeah.
teach him some games of yoga, and then you both,
Yeah.
mom and son, can enjoy that. Okay.
Yes, he will love it. He will love it. Thank you, Dr. Rao.
Sure, my love. Okay.
Thank you.
Bye bye. Okay, everybody. I think it's almost an hour and 18 minutes we had this. I'm happy that I talked about this. I could help a couple of my friends there. And anybody has any requests, let me know. I may show that to you. Like I'm going to show Mabel tomorrow about a little bit of antenatal, postnatal yoga that women can take it up. I cannot show the whole thing; is a lot of thing, but maybe a little bit of it. Okay.
Nicola, let's go eat. Nicola, let's go eat. What is that? Nicola, let's go eat. Come on, babe. Come on. Oh.
Okay. So thank you, and I'll see you again tomorrow morning with my morning routine yoga, and I'll give few suggestions for the pregnant women, and we'll go from there. Thank you. Bye bye.